Registration phase. ACE pelvic registration. By touching the tip pointer of the case iPhone probe tool over the surgical bed and by pressing the point button each time a green sphere appears in augmented reality, the surgeon selects sequentially 3 different points, P1, P2, P3, over the surgical bed in the same plane. Through the selected points the coronal plane is defined and a red hazy transparent plane is depicted, coronal, passing through the green spheres constantly in augmented reality. With the same manner during the registration phase certain stable epicutaneous, predefined, pelvic anatomical landmarks obtained through the drapes, have to be registered. The points that should be acquired are first commence from the more proximal to the operated side in case the operated hip is the right patient's hip but in reverse order in case the operated hip is the left patient hip, the anterior superior iliac spine ASISP4, and second, the more distal to the operated side in case the operated hip is the right patient's hip anterior superior iliac spine, ASIS, P5. Reverse selection in case the operated hip is the left patient hip namely this anatomical point should be registered first, P4, point. By registering both points a green transparent plane transverse plane, passing through the green spheres, perpendicular to previous transparent red plane, coronal, is depicted in augmented reality. By repeating the same procedure and registering at last the symphysis pubis P6, a transparent blue plane appears, sagittal plane, passing through the sphere, perpendicular to previously planes. The planes appeared with different hazy transparent colors sagittal blue, coronal red, transverse green. In augmented reality, app works uneventfully also by placing the patient in lateral decubitus position. In this event only the first step of registration of points over the surgical bed, P1, P2, P3, is changed namely instead of registering point in coronal plane over surgical bed you select the 3 points over the imaginary, perpendicular to surgical bed plane, points from the back of the patient in sagittal plane. Once the surgeon has finally approached patient's bony acetabulum, acetabular registration is performed by the same manner as previously described, with the pointer tip of the SIPT and pressing the point button. 4 anatomical points namely 3 points at marginal circumference of bony acetabulum rim, 1 in anterior superior lip, A7, 1 in posterior superior lip, A8, and 1 in posterior inferior lip, A9. Avoid selecting for registration the anterior inferior margins of the acetabulum. The 4th point in order to complete the acetabular registration should be at the deepest part of the acetabulum, A10. Each time by pressing the point button during registration green spheres appears at pointer tip in AR by the registration of the last point, A10. A blue transparent sphere also appears in augmented reality touching the true medial wall, floor, all acetabular surface, and circumference of the real acetabulum. Inside the blue sphere a magenta sphere appear depicting the center of acetabulum, or the center of rotation. Cylindrical tip pointer of the iPhone case probe is inserted and fit into a specially designed cylindrical slot, which is situated over the back surface of the clamp tool and impacted securely. Surgeon can view a gray cylinder between 2 red spheres, rod, image superimposed in the real surgical field through the iPhone display mimicking the reamer or inserter. The direction of the iPhone case with the rod should be turned manually clockwise or counterclockwise and adjusted accordingly so the gray cylinder between 2 red spheres shown in AR should be aligned with the axis of the reamer or inserter direction. Now the surgeon can obtain positional information in real time in augmented reality of the reamer or the inserter. Over the screen in real time 6 angles appear: anatomical inclination AI, anteversion, AA, operative anteversion, OA, and inclination OI, radiographic anteversion, RA, and inclination RI, concurrently. This helps the surgeon to navigate and obtain positional information and direction with accuracy in real time in augmented reality. Manipulating the reamer or inserter in real time, the surgeon see the change in values of angles. On screen the acetabular dimension is also printed in mm allowing the surgeon to decide in advance the size of starting reamer and the anteroposterior, mediolateral, and craniocaudal positions. According to Lewinnek safe zone the surgeon should place the cup to the optimal, biomechanically sound position, namely anatomic inclination AI in 40 plus or minus 10 degrees and anatomic anteversion in 15 plus or minus 10 degrees, AA, during surgery. As long as the measured values by the app of AI and AA are between the above-mentioned normal range, the printed color of the main screen remains green. Otherwise whenever the respective real-time value are outside the normal range, The values of AI and AA are printed in red color, indicating in real time that the positioning of the cup placed by the surgeon's hand for reaming or impacting is not optimal. In quick view, you have to choose sequentially and manually the following certain anatomical landmarks, points, which are shown below with the correct order. A's is pelvic registration 1 P1, P2, P3 surgical bed, red transparent plain coronal, P1, P2, P3 irrelevant of the order chosen. 2 more distal to the operated side anterior superior iliac spine ASIS P4, 3 more proximal to the operated side anterior superior iliac spine ASIS P5, a green transparent plane transverse plane, P4, P5, 4 symphysis pubis P6 a transparent blue plane appears, sagittal plane, perpendicular to all planes perpendicular to previous transparent red plane, coronal, reality. By repeating the same procedure and registering at last the symphysis pubis P6, B acetabular registration. Following points should be collected at circumference of the bony acetabulum rim. A7, anterior superior lip A8, posterior superior lip A9, posterior inferior lip A7, A8, A9 irrelevant from the order chosen but A10, deepest part of the acetabulum. See screen readings real-time anteversion, inclination angles. Cup diameter, AI anatomical inclination AA anatomical anteversion OI operative inclination OA operative anteversion RI radiographic inclination RA radiographic anteversion D minus cup diameter of the acetabulum. All information received from the software output must be clinically reviewed regarding its plausibility before patient treatment. The app indicated for assisting during operation the operator. Judgment and experience are required to properly use the app. The software is not for primary image interpretation. Any influence the operators in making decisions during operation remains surgeon's own responsibility and experience.